I just say a little bit about what my role is. So I'm the lead director of the County Council responsible for mental health as well as older people. And part of what we do in terms of mental health is we second social workers into CPFT because we're very committed to an integrated model. We also fund support packages for people in the community, and we also have some contracts with the voluntary sector, as well as wanting to work very closely in partnership with a whole range of partners, many of whom are represented here today. So I'm going to give a slightly different perspective, but I think it will build quite well on the presentations that have been given so far. There are lots of different ways of thinking about gaps, as this slide says. Sometimes they're between organisations, sometimes they are between departments in one organisation. So we spend a lot of time in the County Council worrying about transitions and thinking about the gaps in services between children and young people and adults and then older people, and just avoiding a situation where we think about all of these people as if somehow they're very separate and one group doesn't eventually become the next group. And we're also very conscious of gaps in geographical terms. So, for example, we know that the outcomes, health outcomes and educational outcomes for all the people that we support are generally much better in the south of the county than in the north of the county. So if you look at outcomes in Wisbech, for example, they are very, very different from outcomes in particularly in South Cambs. So what are we doing about this? We have recently developed a mental health strategy. We're very conscious of there's a lot of work going on at the moment in terms of strategy development, but we felt that the sort of social aspects of mental health really needed to be addressed. And so the purpose of this strategy is to focus on many of the issues that you'll see listed here. So as I say, we're really, really conscious of this gap between and this transition from children and young people services into adult services, and we feel that's something that we really need to tackle with partners, not just from a clinical mental health perspective, but actually from a wider social perspective and an educational perspective, because many of the people that we are concerned about and support, they may not meet the threshold for specialist mental health services. They may well be being supported in primary care or being supported by the voluntary sector. The other thing the strategy talks about is the need to really improve the way in which we provide information about mental health services. So we often come across situations where people who work in children's services really don't know as much as they need to know about what do you do if you come across a child where actually the key issue is the mental health needs of their parent. And so that's another area that we're very keen to tackle and make sure that despite any organisational arrangements, there's a really clear pathway in those situations. We're very conscious as well when we look at the distribution of our funding, and we have the amount of money we put into staffing is relatively small compared to the amount of money we put into support packages. So we're looking at the support packages in detail. Those are usually enabling people to live in the community independently, but often in supported accommodation of one kind or another. And we know that we have high concentration in the south of the county, and often that doesn't necessarily match where we know the needs are greatest. And the other thing that concerns us and that we're working on at the moment is that there are, as it says here, there are many people who actually might have quite low-level mental health needs, but whose social needs, in terms of how included are they in the community, how much do they have a supportive network of friends and family, do they have a job, do they have neighbours who support them when things aren't going smoothly as they could. Those are the people that really worry us, because often they're the people who aren't in contact with any service and aren't necessarily engaged in any service. And they may well be the people who turn up to A&E and who end up having to have much more of a crisis response. So that's a critical kind of area of work for us, where we will be working very closely with all our partners as part of implementation of the strategy. The gap we often don't talk about is the gap between people in their communities. And I just want to say a few words about isolation. So we know, it's interesting, every year the County Council has to do a survey of all the people who we support in all age groups. And the really strong theme that has come back year after year now is about isolation, and how many people will say to us, actually, I haven't seen anyone or spoken to anyone for not just days, but weeks. And people are now much more articulate about using the word loneliness and being much more explicit of the fact that loneliness is a key issue for them. Now, many of the things that you would do to address loneliness aren't necessarily mental health interventions, but there's absolutely no doubt that they would and will impact on mental health. And one of the biggest challenges facing many of these organisations is the increasing number of people who have dementia or who are likely to suffer from dementia. And we know that isolation and tackling loneliness and issues around community cohesion could be really helpful in that context. I'm not going to dwell on this, but I would just like you to focus just for a couple of, or just for a minute or so, on particularly the slide around social circumstances. And building on what was said by previous speakers, actually, the things that can really make a difference to someone's mental health are the way in which they're parented. Do they have a job? Do they feel safe in the community? Do they have a home? Do they feel valued at work? Is their self-esteem high enough? And actually, do they have enough money? Now, once again, as you know, I'm preaching to the converted here, I know, but you wouldn't describe tackling any of those things as mental health interventions, but actually that's exactly what they are. And if we were to tackle those effectively, not only would we improve mental health outcomes, we would improve many outcomes. So I think what this is really illustrating is this isn't just about the statutory sector, this isn't just about the statutory sector with the voluntary sector and primary care, this is a much wider agenda. And I just want to finish off really by talking about community resilience. It's a term that's used a lot at the moment as public sector organisations think about what can they do to support the people that have a level of need, which means that unless there is a sort of positive intervention quite early on, they are likely to end up needing a statutory assessment from the perspective of social care, and possibly statutory and institutional support or community support, which we would need to fund. Now, clearly, our resources are reducing, and so in that context, it's really important that we don't just carry on doing what we've been doing, but think about, is there a different way of doing this? So we're very in the middle of developing with partners a community resilience strategy. Now, the irony of that is really a county council can't decide to make a community more resilient. This is something that has to be done with the community, with partners. But what we're very clear about is when we ask people, what are the things that make a difference to your life? It's usually not statutory services. It's usually not the sort of brief interventions they might have from us. It's the communities that they live in. So just a few thoughts and examples of what we are doing now. So we have, within Cambridgeshire, our schools have a good programme in place all the way through the schools around emotional resilience and emotional health and well-being. Days like today are obviously incredibly important in terms of public campaigns and the media, but actually, I suppose the question is more, what happens when things don't go well? What happens when there isn't a good news story? How do we work with the media in that context? And that's in many ways a more challenging situation. I've talked about reducing loneliness and isolation, but also, all of us in the room, but certainly as a council, we feel we have a really important role working with adult education and working with employers to make sure that actually that there's a sort of willingness to support people and employ people who may have mental health needs, but also to retain them in that employment when their mental health needs change. So I hope that's helpful in terms of setting a sort of slightly wider community context. But as I say, I think for me the most important thing is if we tackle some of those issues, that will have an impact on all aspects of, and all outcomes actually for the people in the local community, as well as their mental health.
Thank you, Charlotte.